Cancer rates are rising at an unprecedented pace, affecting more people worldwide than ever before. This surge in cases includes many aggressive types, such as pancreatic and brain cancer, which often remain undetected until they have reached an advanced and difficult-to-treat stage. The critical question is, would you be able to recognize the warning signs if your body were trying to alert you? Welcome to Healthy Life, your trusted source for science-backed health insights designed to help you stay informed and proactive about serious health risks. Each year, millions of people receive life-altering cancer diagnoses, and the statistics continue to climb. Many forms of cancer are particularly insidious, showing no symptoms until they are well advanced. However, the reality is that early detection can make a significant difference, sometimes the difference between life and death. Identifying cancer signs before the disease progresses can drastically improve the chances of successful treatment and survival. You might be thinking, every minor symptom seems like cancer when I search online. You're not alone. This confusion is common and often leads to unnecessary fear. That's precisely why this video is different. We sift through the noise and misinformation to deliver scientifically validated warning signs that have helped thousands of people detect cancer early when it's most treatable. Your health is far too important to leave to chance or guesswork. Make the decision today to prioritize your well-being. Subscribe to Healthy Life. Stay alert to what your body might be telling you, and join us as we reveal the 15 crucial warning signs that could save your life. Sign number 15, persistent fever. A fever that lingers or keeps returning without a clear reason could be a red flag for blood cancers such as leukemia or lymphoma. Unlike typical fevers that resolve in a few days, cancer-related fevers often follow a unique pattern and are accompanied by other systemic symptoms. These fevers occur because cancer can trigger your immune system to release chemicals known as cytokines, leading to frequent unexplained temperature spikes. You may also experience night sweats or unexplained weight loss alongside these fevers. If you notice a fever persisting for more than 2 weeks or recurring without any obvious cause, it's crucial to seek medical attention. Blood cancers not only impair your immune system, making you more vulnerable to infections, but also directly cause fever due to abnormal immune responses. Proper evaluation typically involves blood tests to check for unusual cell counts and other disease markers. Sign number 14, jaundice. Jaundice, or the yellowing of the skin and eyes, occurs when bilirubin, a waste product from red blood cells, builds up in your bloodstream. While jaundice can result from various medical conditions, its sudden appearance in adults can be a warning sign of pancreatic or liver cancer. For example, in pancreatic cancer, a tumor can block the bile duct, preventing bilirubin from being properly processed and expelled. This causes bile to accumulate in your body, leading to the yellowing of your skin and the whites of your eyes. This change in color may start subtly, but often becomes more noticeable as the disease progresses. Since the pancreas is located deep within the abdomen, early detection of pancreatic cancer is particularly challenging. Therefore, recognizing jaundice, especially when accompanied by other symptoms like upper abdominal pain, dark urine, or light-colored stools, is critical. Sign number 13, new or unexplained pain. Pain is the body's way of signaling that something is wrong. However, pain that arises without an obvious cause, such as an injury or illness, and persists despite standard treatments, could indicate cancer. For example, abdominal pain could point to cancers like prostate, bladder, testicular, or penile cancer in men. In women, unusual pain or tenderness in the breasts might be an early sign of breast cancer. This type of pain is not typical and does not respond to regular painkillers or home remedies, suggesting that a more serious underlying issue could be present. Internal cancers, such as liver or pancreatic cancer, can also cause persistent pain. For instance, a continuous feeling of heaviness or swelling in the scrotum could signal testicular cancer, while ongoing abdominal discomfort might indicate issues with the liver or pancreas. It is easy to dismiss unexplained pain as a minor issue, but if it persists and is not linked to any known cause, it needs to be thoroughly investigated. Ignoring these signs can be dangerous, as early detection is often key to effective treatment. Number 12. Fingernail marks, subungual melanoma. Subungual melanoma, a rare but dangerous form of skin cancer that develops under the nails, often starts as a seemingly innocuous streak. This dark line, known medically as melanonychia striata, runs vertically along the nail and demands careful attention. Unlike typical nail pigmentation, cancerous streaks tend to appear suddenly and continue to evolve over time. The most common areas for subungual melanoma to develop are the thumb and big toe, although it can occur on any nail. What makes this type of cancer particularly dangerous is how easily it can be mistaken for a normal injury to the nail or even a fungal infection. Key warning signs to watch for include a dark streak that is wider than 3 millimeters, variations in color within the streak, or poorly defined borders that appear irregular. A crucial concept to understand is Hutchinson's sign, which refers to when the dark streak extends beyond the nail and onto the surrounding skin. If you notice any unusual changes to your nails, especially if accompanied by pain, splitting of the nail, or bleeding, it's important not to wait. These symptoms could be an early indication of subungual melanoma. Early recognition and timely medical intervention can significantly improve the chances of successful treatment. Always pay attention to your body's signals, as spotting warning signs early is vital for cancer detection and increasing treatment success rates. Sign number 11. Persistent bone pain. One of the most commonly overlooked symptoms of potential cancer is persistent bone pain. Unlike the temporary discomfort caused by a sprain or muscle strain, cancer-related bone pain intensifies over time and often worsens during the night. When cancer originates in the bones or spreads from other parts of the body, it disrupts the normal structure of bone tissue, causing a deep, aching pain that is difficult to ignore. Primary bone cancer, such as osteosarcoma, typically affects the long bones of the arms and legs. The pain may start subtly, sometimes resembling the discomfort of a sprained muscle, but gradually it becomes more severe and constant. What sets this pain apart from other types is its persistence, and it often does not respond to typical pain-relieving treatments. In addition to pain, you may notice swelling, increased tenderness, or unexplained fractures in the affected area. If you experience ongoing bone pain, it's critical to seek medical attention promptly. Early detection of bone cancer significantly improves treatment outcomes, with survival rates much higher when the condition is diagnosed in its early stages. Don't ignore pain that is out of the ordinary or persists for an extended period. Sign number 10. Eye pain. Your eyes can offer crucial insight into your overall health, including potential signs of cancer. One of the more rare forms of cancer that can manifest in the eyes is ocular melanoma, which is the most common type of primary eye cancer in adults. Symptoms of ocular melanoma often begin subtly but can progressively worsen into noticeable changes that should never be overlooked. When cancer develops in the eye, it can cause a range of distinctive symptoms that are different from common eye issues. For example, you might experience blurred vision that doesn't improve with new glasses, or you could see strange flashes of light that cannot be explained by typical causes, such as migraines. A concerning sign is the development of a dark spot on the iris of the eye, which gradually changes in size or color over time. If you are at higher risk for ocular melanoma, due to factors like prolonged sun exposure or a family history of eye cancer, it's important to be vigilant about your eye health. Persistent eye pain or changes in your vision should not be ignored. Regular eye exams become even more crucial for those at risk, as early detection can help preserve both vision and life. Sign number 9. Excessive bruising. Have you been noticing bruises appearing without any apparent cause? Excessive bruising in unusual areas of your body can be a sign of blood cancers, such as leukemia. Leukemia affects your body's ability to produce healthy blood cells, leading to symptoms like unexplained bruising. These bruises may show up in places you wouldn't typically expect, such as your arms, legs, or other areas where no injury has occurred. If bruising happens frequently, and without any clear reason, it should not be ignored. In addition to bruising, you may experience other concerning symptoms, such as frequent nosebleeds or bleeding gums, which are also linked to blood disorders or cancers. These symptoms can signal a serious underlying issue, and it's crucial to seek medical evaluation to determine the cause. Don't dismiss unexplained bruising as something minor. If you notice an unusual pattern of bruises or if they appear in unexpected places, it's essential to consult a healthcare provider. Early detection of blood cancers like leukemia can make a significant difference in treatment and outcomes. Sign number 8. Persistent cough or hoarseness. Have you been struggling with a cough that just won't go away? A persistent cough or hoarseness lasting for more than 2 weeks should be thoroughly evaluated by a doctor. A dry, hacking cough that doesn't improve can sometimes be a sign of lung cancer, while coughing up blood or experiencing bloody discharge is particularly concerning and requires immediate medical attention. Hoarseness, or a raspy voice that lingers without explanation, can also be indicative of cancer, particularly cancers of the thyroid or throat. If you notice a change in your voice, especially if it is accompanied by difficulty swallowing or pain in your neck or throat, these symptoms should be taken seriously, as they could signal thyroid or throat cancer. Don't brush off a persistent cough or hoarseness as a minor issue. These symptoms can often be overlooked, but when they persist, they may indicate more serious conditions. If you have a cough or hoarseness that lasts more than 2 weeks, consult a healthcare provider to determine the underlying cause and receive the appropriate treatment. Early intervention is key to improving outcomes in cancer detection and treatment. Number 7. Blood in the urine or stool. Noticing blood in your urine or stool is a warning sign that should never be ignored. It can be alarming, but more importantly, it could indicate a serious underlying health issue, including cancer. Blood in the stool may appear as bright red streaks or as dark tar-like stools, depending on where the bleeding is occurring in the digestive system. Conversely, blood in the urine can range in color from pink and red to a dark brown shade, often described as looking like tea or cola. There are several potential causes for blood in the stool, including digestive system cancers like colon or rectal cancer. These types of cancer can cause bleeding as tumors grow and disrupt the lining of the intestines. Blood in the stool can also indicate inflammatory bowel diseases, such as Crohn's disease or ulcerative colitis, which cause chronic inflammation and ulceration in the digestive tract. These conditions not only impact digestion, but can also lead to bleeding and other complications if left untreated. Similarly, blood in the urine can be a sign of prostate or bladder cancer. These cancers can develop silently and without pain, so the presence of blood may be one of the first noticeable symptoms. Other potential causes include urinary tract infections, kidney stones, or more serious conditions like kidney cancer. Regardless of the cause, the appearance of blood in the urine or stool is a sign that something is wrong and should be promptly evaluated by a healthcare professional. One of the challenges with this symptom is that it can be easily overlooked or attributed to less serious causes, such as hemorrhoids or minor urinary infections. However, it is crucial not to make assumptions. If you notice any blood in your urine or stool, especially if it persists or is accompanied by other symptoms like pain, weight loss, fatigue, or changes in bowel habits, seek medical attention immediately. Early diagnosis and intervention are key to treating serious conditions effectively, including cancer. Diagnostic tests, such as colonoscopies, urine tests, and imaging scans, can help identify the underlying cause and guide appropriate treatment. By paying attention to these warning signs and seeking medical advice promptly, you can significantly improve your health outcomes. Number 6. Mouth sores that won't heal. While occasional mouth sores from minor injuries, irritation, or infections are common, persistent sores that don't heal within 2 weeks should be taken seriously. A chronic sore in the mouth, especially one that is painless, may be an early warning sign of oral cancer. This type of cancer can develop on the lips, tongue, gums, inner cheeks, or the roof and floor of the mouth. One of the most concerning signs of oral cancer is the presence of white or red patches inside the mouth. These patches, known as leukoplakia, white patches, and erythroplakia, red patches, can sometimes be precancerous. If these lesions persist or grow in size, they warrant immediate medical evaluation. Unlike regular canker sores, which tend to heal on their own within a week or two, cancerous sores do not go away and may continue to grow or even bleed. People who use tobacco, whether smoking or chewing, and those who consume alcohol excessively are at a significantly higher risk of developing oral cancer. However, even non-smokers and non-drinkers should be vigilant, as oral cancer can also be linked to human papillomavirus, HPV infection, or prolonged exposure to ultraviolet UV rays, which can lead to lip cancer. Additional warning signs of oral cancer include difficulty chewing or swallowing, a persistent lump or thickening in the cheek or neck, numbness or tingling in the mouth or lips, a persistent sore throat or hoarseness. Unexplained weight loss. Since oral cancer can be aggressive, early detection is crucial. A dentist or doctor can perform a thorough examination, sometimes using a biopsy to determine if abnormal cells are present. If you notice any persistent sores, swelling, or unusual patches in your mouth, schedule a medical evaluation as soon as possible. Regular dental checkups play a vital role in oral cancer detection, as dentists can identify suspicious changes early on. Being proactive about oral health and avoiding risk factors like tobacco and excessive alcohol consumption can significantly reduce your chances of developing this life-threatening condition. Number 5. Persistent heartburn or acid reflux. Most people experience occasional heartburn, especially after consuming spicy, acidic, or fatty foods. However, chronic heartburn that persists despite lifestyle changes and medication could be a warning sign of something far more serious: esophageal cancer. Esophageal cancer often begins with a condition known as Barrett's esophagus, which develops when repeated acid reflux damages the lining of the esophagus. Over time, these damaged cells can undergo precancerous changes, significantly increasing the risk of esophageal adenocarcinoma. Key warning signs include frequent or severe acid reflux that does not improve with medication, difficulty swallowing, feeling like food is stuck in the throat, chronic sore throat or hoarseness. Unexplained weight loss, a persistent cough, especially at night. Acid reflux alone does not mean you have cancer, but if you experience any of these symptoms persistently, it is essential to consult a healthcare provider. Ignoring chronic acid reflux can lead to progressive damage, increasing the likelihood of cancerous changes. If your symptoms are severe, your doctor may recommend an endoscopy, a procedure in which a small camera is inserted into the esophagus to examine any abnormalities or precancerous changes. Treatment options depend on the severity of the condition, but may include lifestyle modifications, medications, or, in some cases, surgical interventions. The best way to reduce your risk is to manage acid reflux effectively by maintaining a healthy diet, avoiding trigger foods, quitting smoking, and reducing alcohol intake. Early intervention can prevent minor digestive issues from progressing into life-threatening diseases. Number 4. Changes in urinary or bowel habits. Your body's excretory functions provide important clues about your overall health. While occasional digestive disturbances are normal, persistent changes in urinary or bowel habits can be early warning signs of serious health conditions, including cancer. For bowel habits, pay attention to persistent diarrhea or constipation lasting more than a few weeks without an apparent cause, narrow or thin stools that continue over time, which may indicate an obstruction in the colon, blood in the stool, which can appear as bright red blood or cause the stool to look dark or tarry, abdominal pain or cramping associated with bowel movements, a feeling of incomplete evacuation even after using the restroom. These symptoms can be indicative of colorectal cancer, particularly if they persist without explanation. Colorectal cancer develops in the colon or rectum and often begins as benign polyps that can become cancerous over time. Early detection through colonoscopy screenings can identify and remove polyps before they turn into cancer. In terms of urinary habits, be on the lookout for blood in the urine, hematuria, which may appear pink, red, or dark brown, pain or burning during urination, frequent or urgent need to urinate without increased fluid intake, difficulty starting urination or a weak urine stream, pelvic pain or discomfort. These symptoms can be associated with bladder or prostate cancer. Blood in the urine, even if it appears only once, should never be ignored as it could signal urinary tract issues or cancer. In men, urinary difficulties might also indicate prostate cancer, especially if accompanied by back pain or unexplained weight loss. If you notice persistent changes in your bowel or urinary habits, it's crucial to seek medical evaluation. Early detection of colorectal, bladder, or prostate cancer significantly improves treatment outcomes. Screening tests such as colonoscopy, fecal occult blood tests, urine analysis, and prostate-specific antigen (PSA) tests can aid in early diagnosis. Maintaining a healthy diet rich in fiber, staying hydrated, and leading an active lifestyle can reduce the risk of colorectal cancer. Additionally, avoiding tobacco and managing risk factors like obesity and diabetes can lower the likelihood of developing bladder or prostate cancer. Sign number 3. Body rash. When it comes to changes in your skin, certain rashes should raise immediate concern as they could signal a serious underlying condition like leukemia. Leukemia is a type of cancer that affects blood-forming tissues, and it can manifest in ways that might be mistaken for minor skin conditions. However, these rashes have distinct characteristics that set them apart from more common rashes. One notable sign is petechiae, tiny round spots on the skin caused by platelet deficiency, which is common in leukemia. These spots are typically very small, around 1 to 2 millimeters in size, and they don't fade or disappear when you press on them, unlike the redness or irritation seen in typical rashes. Their color can range from red to purple to brown, and they often appear in clusters, particularly in areas where pressure is commonly applied, such as around the ankles or where tight clothing fits. The key to understanding petechiae is recognizing that leukemia disrupts your body's ability to produce sufficient platelets, which are essential for blood clotting and preventing bleeding. When platelet levels drop, tiny blood vessels in the skin, called capillaries, can leak, causing these characteristic spots to form. This is not a typical rash that might itch or fade over time. Instead, leukemic rashes persist and may be accompanied by other concerning symptoms like unexplained bruising or bleeding. If you notice any unusual rash or skin changes, especially if they don't respond to typical treatments or fade with time, it's important to seek medical advice. The presence of petechiae, combined with other symptoms such as easy bruising or frequent nosebleeds, should raise red flags for leukemia and warrants immediate evaluation by a healthcare professional. Early detection of blood cancers can significantly improve treatment outcomes and quality of life. Sign number 2. Persistent headache. Do you find yourself dealing with a headache that just won't go away, no matter what you do? Persistent headaches that linger despite taking over-the-counter pain relievers or prescribed medications can be more than just an inconvenience. They could be a warning sign of something serious, such as a brain tumor or other forms of brain cancer. Unlike typical headaches caused by stress, dehydration, or minor illnesses, cancer-related headaches often have distinct characteristics. They tend to intensify over time, becoming more severe and constant, and are often worse in the morning or when you change positions, like bending over or lying down. This is due to the pressure a tumor can place on the brain, especially when fluid shifts inside the skull. In addition to the persistent headache itself, you might notice other neurological symptoms, which are crucial warning signs that shouldn't be ignored. These can include blurred or double vision. If you experience vision changes that come on suddenly or don't improve with corrective lenses, it could indicate pressure on the optic nerve. Hearing changes, such as ringing in the ears, tinnitus, or loss of hearing on one side. Facial drooping or numbness. This can occur if a tumor is pressing on nerves that control facial muscles. Difficulty with balance or coordination, making it hard to walk or carry out fine motor tasks. Seizures or other unusual neurological events. Even if you've never had seizures before, a brain tumor can disrupt electrical activity in the brain, leading to sudden, unexplained seizures. What makes cancer-related headaches particularly concerning is that they don't respond to typical painkillers and continue to worsen over time. They may also be accompanied by nausea and vomiting that is more severe in the morning, again due to increased intracranial pressure. It's essential to pay attention to your body and recognize when something isn't right. Not all persistent headaches are linked to cancer, but those that don't improve with standard treatments and are accompanied by other neurological symptoms should be thoroughly investigated by a healthcare professional. They might order diagnostic tests such as an MRI or CT scan to examine the brain more closely. Early detection is crucial, as it can significantly improve the prognosis and treatment options for brain tumors and other neurological conditions. If you or someone you know is experiencing these symptoms, don't delay seeking medical help. Your health is too important to ignore these potential warning signs. Sign number 1. Persistent fatigue. Have you been feeling unusually tired lately, no matter how much rest you get? Persistent fatigue is one of the earliest and most overlooked signs that something serious, like cancer, could be growing in your body. This isn't just the typical tiredness you might feel after a busy day or poor sleep. It's a deep, unrelenting exhaustion that doesn't improve with rest or sleep. This type of fatigue can be particularly indicative of cancers such as leukemia or lymphoma, which affect the blood and bone marrow. These cancers disrupt your body's ability to produce healthy blood cells, leading to a reduced oxygen supply throughout your body. As a result, you might feel worn out, weak, and constantly drained of energy, regardless of how well you sleep or how much you try to rest. But persistent fatigue isn't limited to blood cancers. It can also be linked to colon or stomach cancer. These cancers can cause internal bleeding, leading to anemia, low red blood cell count, which reduces the oxygen-carrying capacity of your blood. This results in chronic fatigue, weakness, and even shortness of breath. Lung cancer. The body has to work harder to get enough oxygen, leading to continuous tiredness. Cancers that alter hormone levels, such as thyroid cancer, which can disrupt your metabolism and energy balance. In addition to fatigue, you might also experience muscle weakness, feeling unusually weak even during simple tasks. Confusion or difficulty concentrating, making it hard to focus on tasks or remember things, which can be due to reduced oxygen supply to the brain or chemical imbalances caused by cancer. Mood changes. Chronic fatigue can lead to irritability or feelings of depression and anxiety, making it difficult to perform daily activities. Why is persistent fatigue often overlooked? Many people dismiss this symptom as a result of stress, overwork, or aging. However, when fatigue is severe, long-lasting, and not relieved by rest, it could be a sign that your body is trying to tell you something more serious. It's particularly concerning if it's accompanied by other symptoms like unexplained weight loss, night sweats, fever, or pain. When should you see a doctor? If you find yourself unusually tired for an extended period, it's crucial to consult a healthcare provider. They can conduct a thorough examination, including blood tests to check for anemia or abnormal blood cells, and imaging tests like X-rays or CT scans to rule out serious conditions like cancer. Early detection and diagnosis can make all the difference, significantly improving treatment outcomes and overall prognosis. So, if your body is showing signs of extreme fatigue that just won't go away, don't ignore it. Take action. Cancer can be a silent invader, often disguising itself behind symptoms that seem harmless or unrelated. But as we've explored, signs like persistent fatigue, unusual rashes, blood in urine or stool, and persistent headaches can sometimes be your body's way of signaling that something more serious is happening beneath the surface. Early detection is crucial, and recognizing these warning signs can make a life-saving difference. If you've noticed any of these symptoms, don't ignore them. Listen to your body and consult a healthcare professional to get the right tests and evaluations. It's always better to be cautious and proactive rather than waiting until it's too late. Remember, this video isn't meant to diagnose, but to empower you with knowledge so you can take control of your health. Your well-being is your greatest asset, and staying informed is your best defense against serious health conditions like cancer. If you found this video valuable, give it a thumbs up and share it with those you care about. You never know who might need this information. Also, don't forget to subscribe to Healthy Life for more expert-backed health insights that empower you to take control of your well-being. Stay informed, stay proactive, stay healthy. We'll see you in the next video. Until then, take care and stay strong.